I'll start my class right now, okay? So today's topic is leptospirosis. So it is also known as field fever, eye cathars, yellow fever, 7 days fever, cane field fever. Okay, so this is different names of leptospirosis. So it's an acute febrile generalized disease whose manifestation can range from mild self-limiting to fatal multi-organ involvement. So it's basically the causative agent is a spiral bacteria that belongs to the genus Leptospira, and it has two species, Leptospira enterogens and Leptospira biflexi. And the pathogenic one is Leptospira enterogens. Okay, so we are going to deal with enterogens. So rat is the principal source of infection. Other reservoirs include wild animals like domestic animals like dog, cat, and livestock. Human infection occur due to the exposure to the water or soil contaminated with the rat urine. Okay, so direct contact with the rat urine, or if the contact with the soil or water contaminated with rat urine. Hence, it is an epidemic during the monsoon or post-monsoon period when a lot of paddy fields are filled with rats and their urine. Okay, so basically the leptospira in the soil, it enters the skin or mucous membrane, it enters into the bloodstream. From the bloodstream, it enters into organs. So when it is in the bloodstream, it is known as leptospiremia. So it is still in the blood only. It's not reached any organs. So when it is in the blood only, it produces a disease like an influenza or a typhoid-like fever. So it will have fever, coryza, okay, pain abdomen, little bit of diarrhea, something like that. So it will be difficult to differentiate between influenza fever or a typhoid fever. When it enters into from bloodstream, it enters into the organs. Okay, so now it can enter lungs. So it will produce hemorrhagic pneumonitis. Later on, can produce pulmonary hemorrhage. It enters into the liver. In the liver, it produces hepatitis, and later on, it is also produces enterohemorrhagic phase of leptospirosis. It enters into kidneys, producing interstitial nephritis, and later on leading to renal failure. And renal failure is the cause of death in case of leptospirosis. Okay, and it also enters the brain, leading to meningoencephalitis. So basically, leptospira damages the endothelial lining of the blood vessels, leading to vasculitis, with leakage leading to ischemic changes to different organs. Okay, so basically, blood vessels are affected, leading to ischemic changes, leading to all these things. That's why different organs are affected. So transmission is through direct contact, like if you have skin abrasions or if you got contact with the mucous membrane, it can enter. Indirect contact from the broken skin with contaminated soil or vegetation. Direct means direct contact with the rat urine. Indirect means when the rat urine is contaminating the soil, water, or vegetation. Then is droplet infection. If you are breathing in a polluted air with droplets of urine of different animals, like if while milking the cattle, if the droplets of urine are is in the air and person is taking the breath of that. So leptospira can be infected from the urine or direct exposure of the urine. Okay, so WHO has classified the disease into 4 patterns. So one is mild influenza-like illness. Second is a Weil syndrome, in which jaundice, renal failure, hemorrhages, and myocarditis occurs. Then is meningitis and meningoencephalitis, and fourth is pulmonary hemorrhage with respiratory failure. Okay, so these are the different types of presentation. So Indian Leptospira Society recommends to suspect leptospirosis if the patient has fever, body ache, and any one of the following. Okay, fever and body ache is always in generally viral illnesses. So if any one of these, like jaundice, oliguria, cough and breathlessness, any hemorrhagic tendency in the body, like any bleeding from any side, any rash, okay, then meningism or altered sensorium in the patient, then you should always suspect leptospirosis. So there is a term known as Anicteric leptospirosis, in which jaundice is still not present. Okay, so Anicteric leptospirosis generally has a septicemic phase, which occurs in 4 to 7 days of illness. So 4th day of fever, 5th day of fever, and the child is in septicemia, you should suspect Anicteric leptospirosis. Child will present with abrupt onset of fever with severe muscle pain. So in this case, muscle pain will be very severe. He will be telling you that he has a lot of calf muscle pain. And on examination, calf muscle tenderness is also there. So calf muscle tenderness is very important point. If you find, then you should suspect always a leptospirosis. Muscle pain, headache, vomiting, and abdominal pain. And sometimes patient may have meningism. That features of neck rigidity may be there. Immune phase. It's an important phase. Feature in this phase is fever is less pronounced. So septicemic phase, later on is immune phase. Fever is less pronounced than earlier. Aseptic meningitis can be seen. In this, hepatic involvement occurs. Liver becomes enlarged, and you may find icteric on examination, or if you see investigation, bilirubin will be raised with raised enzymes. Renal involvement. There may be hematuria, proteinuria, azotemia means decreased urine output, renal failure, oliguria, and anuria. So, renal failure is the principal cause of death in case of leptospirosis. Icteric leptospirosis is a term in which is also known as Weil syndrome. So it's a severe form of the illness. All features of anicteric leptospirosis will be there. Plus, patient will develop jaundice, azotemia within 3 days of illness. Okay, 3 to 7 days of illness. Child will fastly go into renal failure and jaundice. Okay, so increasing jaundice leading to more risk of renal failure plus hemorrhage plus cardiovascular collapse will later on lead to fatality. Okay, so if you see leptospirosis, if it goes into hemorrhagic state, the prognosis is little bit bad. Okay, so we should suspect it earlier, and if even if in the icteric stage, if it is diagnosed earlier, we can do something. Otherwise, if later stage, it's really difficult to save the patient. Leptospirosis diagnosis. So it can be diagnosed from a culture of blood or CSF during the first days of illness, or it can be cultured from the urine of the patient for several weeks. But this culture is very poor. We do not get a lot of cultures as leptospirosis. Okay, it's really difficult to get a culture positive. So sometimes we can do direct field microscopy, direct visualization of leptospira. Okay, it's a spiral bacteria. In the dark field microscopy, they can find, but it's also difficult. So what we do generally is we detect the antibodies of leptospira. Basically, we do the MAT test or ELISA test. Okay, so MAT is microscopic agglutination test. It's a serovar specific, means it will diagnose the leptospira intelligence also, and it is a gold standard of test. It is positive after 12 days of illness. So it is later on in the early phase of illness, it will not be positive. Okay, it is positive after 12 days of illness. High titer of 1:100 or 4 rise in 2 weeks is a diagnostic test for leptospira. So if you do it early and you don't find it positive, high titer, but if you repeat it in 2 weeks and it is 4 rise, it is again a diagnostic. Okay, so basically we do the antibody testing for leptospira. Sometimes ELISA test, IgM antibody is also present, and generally this is also done in our scenario. Best is MAT, microscopic agglutination test, but sometimes it is also not available, then ELISA is done. So it is sensitive but not very specific. And microscopic slide agglutination test can also be done but not used. Okay, so treatment. So penicillin is the drug of choice. 250,000 units per kg per 24 hours you can give penicillin in 4 divided doses for 7 days. So these days, if you do not use penicillin, then amoxicillin, ciprofloxacin can also be used. If the child is above 8 years old, tetracycline can also be used. So see, so the common antibiotics, amoxicillin and penicillin, which we use for all other illnesses. So generally pneumonia, in upper respiratory tract infections, and even in infective other causes, we generally use amoxicillin and penicillin. So that only drug can kill leptospira. So leptospira is sensitive. So generally we can treat the patient without actually diagnosing. But if the patient goes into severe illness, okay, when the severity is more, so that is a phase in which it's really difficult. So diagnosis is important for preventing the fatality. Okay. So prevention and control, basically the control of the infection source is important. So that's why when is monsoon season, we try to control the rodents So we put a lot of rodent control, pest control things, that is pesticides, over the nearby the paddy fields. Okay, so rodent control and animal vaccination. If you have pet animals in the house, we generally advise for vaccination. So interruption of transmission route, that is wearing of protective clothing, refrain from contacts with the infected animals, avoid swimming in contaminated water, and providing a clean drinking water is the route from where we can interrupt the transmission. So prevention or disease in the human host. Okay, so vaccination, antibiotic prophylaxis, and information to the doctors, veterans, and risk group and for the general population. Generally, for general population, we don't have any vaccination for leptospirosis. But if a person works in a veterinarian wherein he has to deal with the animals a lot of time, or high risk groups, then sometimes vaccination can be advised, but it's not for the local general population. And vaccination is not there for leptospirosis. Okay, so thank you. Though we have a lot of trouble, but I had a last good small class. So I think we could finish it off in time.
Thank you, ma'am.
Anyone have any question? We can take it. How much time we have?
No, ma'am.
Okay, thank you. Let's end.